HESC 114, Intro to Pharmacology, Chapter 14, Endocrine Drugs. Chapter 14 covers drugs that are used to treat endocrine imbalance. The endocrine system and the nervous system are the two systems in the body that keep the body in balance, which is known as homeostasis. The chemical messengers secreted by the endocrine glands into the bloodstream are hormones. When there is a deficiency of hormones, drugs are used as replacements for the missing hormones. The endocrine system consists of many glands that are in various locations throughout the body. Endocrine glands are alike in that they secrete hormones into the blood. Hormones are chemical messengers of the endocrine system. The function of the endocrine system is to use its hormones to affect specific body organs so as to regulate body fluids, electrolytes, glucose, cellular metabolism, growth, and other functions. Hormones from the endocrine glands help maintain homeostasis, which is a state of equilibrium in the body's internal environment in which all body systems can function optimally. When an endocrine gland malfunctions, it secretes either too little or too much of its hormone, and this can be corrected by administering a drug. Endocrine drugs are used as replacement therapy to treat diseases that occur when an endocrine gland secretes too little hormone, or to suppress the secretion of an endocrine gland when it secretes too much hormone. Other endocrine drugs, your corticosteroid drugs, are used to treat the inflammation that is associated with many different diseases. This chapter discusses diseases that affect the endocrine gland of the pancreas, thyroid gland, adrenal glands, and ovaries and testes, and the drugs used to treat them. Diseases of the hypothalamus, pituitary gland, ovaries, and testes, and the drugs used to treat them will be discussed in Chapter 11, Reproductive Drugs. The pancreas is a large, yellow, triangular-shaped endocrine gland that is located posterior to the stomach. It secretes hormones from three groups of cells known collectively as the islets of Langerhans. Alpha cells in the islets of Langerhans secrete the hormone glucagon. When blood sugar, glucose, level is low, glucagon secreted by the pancreas stimulates the liver to release stored glucose, known as glycogen, into the blood. Glucagon increases glucose levels in the blood. Beta cells in the islets of Langerhans secretes the hormone insulin, which decreases blood sugar or blood glucose levels. Delta cells in the islet of Langerhans secrete the hormone somatostatin. Somatostatin inhibits the secretion of both hormones, glucagon and insulin. There are different types of DM, or diabetes mellitus, but in all types, the body has an inability to make and or use insulin properly. The type of diabetes mellitus can be found on page 344 of your textbook. Drugs that we use to treat diabetes mellitus include human insulin drugs and insulin drug analogs, non-insulin subcutaneous antidiabetic drugs, non-insulin oral antidiabetic drugs, human insulin drugs, and insulin analogs. There are different types of insulins based on how they act in the body. Some will be rapid acting, short acting, intermediate acting, long acting, and then we have combinations. All insulins are administered subcutaneously. Insulin is measured in units, and it's administered using a special syringe known as an insulin syringe. Most units are what are known as U100, which means there is 100 units per milliliter of drug. There are some U200, U300, U500 insulins. Those insulins are used in patients who need a larger dose. Grouping insulins by their onset of action and how long they produce their effect in the body is the most common way. So starting with rapid-acting insulins. Rapid-acting insulins can be taken for type 1 and type 2 diabetes mellitus. They are administered before eating. The onset of action is as quick as 5 to 15 minutes and will last 2 to 4 hours. The insulin analog drugs are given by subcutaneous injection, subcutaneous infusion via an insulin pump. Insulin Lispro is known by brand names Humalog is the most common, also by Admelog and Limegev. Short-acting insulin, human insulin, and insulin analog drugs are used to treat type 1 and type 2 diabetes. These drugs are administered before eating. The onset of action is within 30 minutes, and their therapeutic effect lasts 3 to 6 hours. These drugs are given subcutaneously. Human insulin is one of the trade names, Humulin R is one of the trade names of the generic human insulin regular. It belongs to the short-acting insulin drug category, which is also known as regular acting. The R in its trade name means regular, and the U100 on the box shows its strength, which means that there is 100 units for every milliliter. This drug can be administered with a special insulin syringe that's calibrated in units. The rDNA indicates that this drug was created by recombinant DNA technology. Regular insulin is available through the brand names Humulin R, made by Eli Lilly, or Novolin R from Novo Nordisk. This is a solution, and it's the only type of insulin that can be administered IV. Intermediate-acting human insulin drugs are used to treat type 1 and type 2 diabetes mellitus. The onset of their action begins 2 to 4 hours after injection. Their therapeutic effect can last 12 to 18 hours. These drugs are given subcutaneously. They are not given intravenously. It includes isophane insulin, human isophane insulin, which is also known as NPH. So the brand names include Novolin N or Humulin N, and that N is for that NPH. Long-acting insulin are used to treat type 1 and type 2 diabetes mellitus. The onset of their action does not begin to lower the blood glucose level for several hours. Their therapeutic effect lasts up to 24 hours after just one dose. These drugs are given subcutaneous injection. They're not given intravenously. These are sometimes referred to as basal insulins because they maintain the blood sugar level over a 24-hour period. The drugs in this group include insulin deglutec, which is known by the brand name Tresiba. We see here that it comes in multiple strengths. This is a U100 and this is U200. The doctor has to identify the strength. Now, these are insulin pens. Previously, these are insulin vials. Patients would have to draw up the medication into an insulin syringe. Here, they can dial their dose, so it makes dosing a little bit easier for the patient because they don't have to draw it up. Another of the long-acting insulins include insulin Detmir, which is Levemir. This comes both in a vial and in a pen. And then we have insulin glargine. Insulin glargine is known by the brand names Lantus, which is the 100 or U100 insulin, and by Basaglar, which is also a U100. And then we have Toujeo, which is a U300. Regular insulin, back at the rapid acting insulins, that one can come U500. There are also combination insulins. These drugs contain a combination of human insulin, such as isophane or regular insulin, or a combination of insulin analog drugs, such as aspart, asparprotamine, Lispro, or Lisproprotamine. The numbers show the percentage of each of the type of insulin. So it could say 50-50, it could say 75-25, it could say 70-30. If it says 75-25, that means it contains 75% of one insulin and 25% of another. These are used to assist ease of administration for a patient so that they don't have to mix their own combination. So, for example, we have insulin lispro protamine 50% with 50% insulin lispro. That is a Humalog mix 50-50. Or here we have Humulin 70-30, which is human insulin isophane with human insulin regular. Because the insulin molecule can be broken down by the digestive enzymes, insulin can never be given orally. Patients with type 1 diabetes and even some persons with type 2 inject insulin via the subcutaneous route once or several times a day at various sites on the upper arm, thighs, or abdomen where there is some subcutaneous fat. So over here we have an image, and it's generally going to be at approximately a 45-degree angle. Here we have them injecting into their abdomen. Insulin must be injected subcutaneously into the fat layer between the skin. The needle is inserted at a 45-degree angle so it does not go into the muscle layer. The upper arms, thighs, abdomen, and other sites can be used for insulin injections. A new site must be selected for each injection to avoid tissue damage. This process is known as site rotation. Insulin is administered using a special syringe known as an insulin syringe. An insulin syringe is used to administer liquid insulin that comes in a glass vial. It's never used to administer any other type of liquid. Its calibrations are unique because they are in units, which is a standardized measurement for insulin. Most insulins are U100, which means there's 100 units in each milliliter of drug. So if the doctor writes for 34 units, we've got 30, 32, 34. They could easily draw up the exact amount. Now on the other side of the syringe, it may be the odds. This is the even side. Again, most of your insulins are going to be U100. There are some that come U200, Tresiba, U300, Toujeo, U500, regular insulin, U500. Insulin can also be administered directly into the blood via an insulin pump that has a tubing connected to it and is attached to a belt or carried in a pocket. An alarm sounds if the tubing is blocked or the insulin reservoir is empty. Newer insulin pumps do not have tubing. Instead, there's a needle on the back of the device which has an adhesive pad to hold it to the skin. Insulin pumps can provide continuous small doses of insulin that mimic the secretions of the pancreas. A sensor monitors the level of the glucose in the blood every few minutes and determines if more insulin is needed. The insulin pump can increase or decrease the amount of insulin given depending on the blood glucose level. An insulin pump attaches directly to the skin with an adhesive patch that contains a small needle. It has a reservoir of insulin and a pump mechanism. So this is one of the older versions of an insulin pump. Most of the ones today are, they have adhesive and are attached at the upper arm. And they have a reservoir of 1 to 3 milliliters of insulin. Non-insulin oral anti-diabetic drugs, also known as oral hypoglycemic drugs. These are used to treat diabetes, but are effective only in treating type 2 diabetes mellitus. These drugs will either help increase the production of insulin or decrease the receptor's resistance. There are 9 categories of oral anti-diabetic drugs. The first class are alpha-glucosidase inhibitor drugs. These do not increase insulin production from the pancreas, but inhibit the action of 2 enzymes that are needed to digest carbohydrates. The enzymes amylase, produced by the pancreas, and the enzyme alpha-glucosidase glucoside hydrolase, produced by the small intestines. When these 2 enzymes are inhibited, a decreased amount of glucose enters the bloodstream from digestion, thus lowering the blood glucose levels. the pancreas does not need to produce as much insulin. These drugs are given orally. These are older drugs, and the prototype is Archibos, which is known by the brand name Precos. Big one-eye drugs have 3 different therapeutic effects, each of which lowers the level of glucose in the blood. They decrease the absorption of glucose from the intestine, they decrease the release of stored glycogen from the liver, and they improve the sensitivity to and ability of the cells to use any insulin that is produced by the pancreas. It's considered to be an insulin tissue sensitizer. Because this drug does not stimulate the pancreas to secrete more insulin, it is often included in combinations with other drugs that do stimulate the pancreas to secrete insulin, or drugs that are known as secretagogues. These drugs are given orally. The drug metformin is the only one in the big one-eyed class. There are different brand names, including Fortimet, Glucophage, and Riomet. Riomet is actually an oral solution. Bile acid sequestrant drugs are commonly used to treat elevated levels of cholesterol in the blood. However, they also increase the hormone GLP-1 that stimulates the pancreas to secrete insulin. This improves blood glucose control in patients with type 2 diabetes mellitus. Cholceveram is the only one of the bile acid sequestrant drugs that has this effect. This drug is given orally. It is known by the brand name Welchol. Dipeptidylpeptidase 4, or DPP-4 inhibitor drugs, prolong the action of 2 hormones, GLP-1 and GIP. These hormones are secreted into the blood by cells in the small intestine after food is eaten. These hormones normally stimulate the beta cells of the pancreas to make insulin. DPP-4 is an enzyme that normally inactivates these 2 hormones after a period of time. DPP-4 inhibitor drugs block DPP-4 from inhibiting the 2 hormones and prolong the desirable effect of GLP-1 and GIP. These drugs are also given orally. The drug prototype is sitagliptin, which is known by the brand name Januvia, and also saxagliptin, which is known by the brand name Onglyza. DPP-4 inhibitors have the drug stem of gliptin. Meglitinide drugs block the flow of potassium but allow calcium ions to flow through the channels in the cell membranes of the beta cells. This increase in intracellular calcium stimulates beta cells to secrete more insulin. These drugs are given orally. Repaglinide is known by the brand name of Prandin, and it has the drug stem for a meglitinide is glinide. SGLT2 inhibitors, or sodium glucose cotransporter 2s, inhibitor drugs, inhibit the protein that transports both sodium and glucose from the renal tubules back into the blood, the process of reabsorption as urine is produced. When transport is inhibited, the glucose is kept in the renal tubules and is excreted in the urine, and the blood glucose levels will decrease. These drugs are given orally. They include canagliflozin, which is known as Invokana, and dapagliflozin, which is known as Farxiga. And we've talked about this in a previous chapter. So the drug stem for these are gliflozin. So your SGLT2 inhibitors are gliflozin. Sulfonylureas were the first anti-diabetic drugs that could be given orally. They were introduced in the 1950s and were structurally similar to anti-infective sulfonamide drugs, which is how they got their name, but they were not effective against infection. Sulfonylurea anti-diabetic drugs stimulate the beta cells of the pancreas to produce more insulin, decrease glucagon release from the liver, and increase the sensitivity of insulin receptors. Sulfonylureas are considered to be secretagogues. They increase the secretion of insulin. These drugs are given orally. There's many look-alike, sound-alikes. The prototype, the one on your drug list, is glipizide, which is known by the brand name Glucotrol. It's controlling glucose. This generic anti-diabetic drug comes in regular tablets as well as extended release, as we see on this image with the XL. There is going to be a cross-sensitivity. If someone is allergic to sulfonamide antibiotics, they will probably also be allergic to sulfonylureas. Thiazolidinediones, how's that for a mouthful? We just call those TZDs. They do not stimulate the pancreas to produce more insulin. Instead, they increase the sensitivity of the body cells to any insulin that is produced by the pancreas. These are tissue sensitizers. TZD sensitizes tissues. The drugs include rosiglitazone, which is known by the brand name Avandia. So the drug stem is glitazone. So one of my former students used to tell me TZDs are in the zone, and that's how they remembered the drug stem. Now there are non-insulin oral anti-diabetic drugs that are in the other category. They don't fit into the main groupings. That includes bromocriptine, which we've talked about previously. It's a dopamine agonist. It stimulates dopamine receptors in the brain. We use it to treat Parkinson's disease, but we also use it in treating type 2 diabetes mellitus. It helps to reset the hypothalamus and the circadian rhythm of the body that have been changed by obesity to reverse insulin resistance. This drug is given orally. So bromocriptine is the generic name, and cycloset, it's resetting the cycle with the circadian rhythm, is the brand name. And then we have combination oral drugs. There are many combination agents. Most will combine an agent that increases insulin production, a secretagogue, with an agent that enhances the receptor sensitivity, a tissue sensitizer. These combination drugs can include a biguanide, such as metformin, and one of the following drugs: a DPP-4 inhibitor, an SGLT2 inhibitor, or a sulfonylurea drug, or a TZD. Other combination drugs contain various forms from these different categories. These combination drugs are all given orally. So here I have pictured Janumet, Januvia with metformin, Janumet, they merged the two names. Sitagliptin is a DPP-4 inhibitor, and metformin is a biguanide. Again, sitagliptin is known as Januvia. When we combine it with metformin, it's Janumet. There are also agents that are not oral. These are non-insulin subcutaneous anti-diabetic drugs. So these are given by injection. These include amylin mimetic drugs and GLP-1 receptor agonist drugs. Unlike non-insulin oral anti-diabetic drugs, these are injected subcutaneous. They are used to treat type 2 diabetes mellitus, but can be used to treat type 1 that is not well controlled on insulin alone. Amylin mimetic drugs have an action that mimics the action of the natural amylin, which is a substance that is secreted from the beta cells of the pancreas at the time that insulin is secreted. Natural amylin and amylin mimetic drugs slow the rate at which food leaves the stomach. It increases gastric emptying time, which suppresses the release of stored glucose, glycogen, from the liver, and work in the brain to suppress the appetite. These drugs are used to treat type 2 diabetes mellitus, but like I said, can also be used for type 1. And it includes the drugs pramlintide, which is known as Similinpen. GLP-1, or glucagon-like peptide 1 receptor agonist drugs, stimulate GLP-1 receptors on the beta cells to increase the secretion of insulin while slowing the emptying of food from the stomach. These drugs are injected subcutaneously to treat type 2 diabetes mellitus, except for the drug Rybelsus, which is a tablet and is taken orally. The first drug, exenatide, is known by the brand name, oops, I've got them out of order. All right, we'll go with deglutide, which is Trulicity. And then we have exenatide, which is Byetta or Bydureon. Now, Bydureon is the extended release formulation. Check your book out. There's some interesting things. This was the first GLP-1 receptor agonist drug, and it's actually manufactured from the saliva of a Gila monster, which is a really interesting lizard found in the southwest U.S. And then we have semaglutide, which has two different formulations. The first one is Ozempic, which is injectable, and then we have Rybelsus, which is oral. So when we're looking at these, the drug stem is glutide, and we know there's a lot in the news these days about Ozempic and these drugs being used for weight loss. We don't know the long-term effect of these drugs. We're seeing some of it in the short term, which has not been really good outcomes for people who are using it for weight loss. There's a thing called Ozempic face. People who lose weight very rapidly when taking these drugs. The challenge when using these for weight loss is the patient will have to be on them for the rest of their life, or else they're going to gain the weight back. So patients should really talk to their doctors before trying to use these drugs for weight loss. Don't use it as a quick fix is really what it comes down to. And then we have combination insulin, non-insulin drugs. This is a long-acting insulin analog, insulin degludec with insulin or insulin glargine with a GLP-1 agonist, liraglutide. So here we have insulin glargine with lizexenatide, which is known as Soliqua. And then we have over here degludec with liraglutide, which is Zoltofi. The thyroid gland is a small endocrine gland located in the neck. It has two lobes connected by a bridge of tissue that lies across the upper trachea. The thyroid gland secretes three hormones, two of which we will discuss here: triiodothyronine, which is T3, and thyroxine, or tetraiodothyronine, which is T4. These hormones increase the rate of metabolism throughout the body. There are two types of thyroid dysfunction: hypothyroidism, where too little thyroid hormone is produced, and hyperthyroidism, where there is too much thyroid hormone produced. So the drugs we use for treating hypothyroid, these are thyroid replacement drugs. We're not producing enough, we're going to need to replace it. So the drug that contains only T3, or triiodothyronine, is liothyronine. It's known by the brand name Cytomel, which is the oral formulation, or Triostat, which is the injectable. Trio for 3. T4, tetraiodothyronine, or thyroxine, the generic drug is based on the molecular structure of the natural hormone thyroxine, but in its molecules, they're rotated left, which is levo. So these drugs are levothyroxine. These are synthetic, so one of the brand names is Synthroid, and the other is Levoxyl. So I've used Levoxyl first, and I'm showing here two things. The shape of Levoxyl is kind of shaped like a little thyroid gland, and the other, like warfarin, back when I talked about hematologic drugs, the colors are specific to the strength. So every single levothyroxine, whether it's a brand name product or a generic product, if they get an 88 microgram, it's going to be olive. So it really helps with that patient knowing their dose is appropriate based on color, because a lot of times patients are like, that's not mine, I take a white pill or I take a green pill. These are all going to be the same across any brand, any generic. I didn't make a little sticker on this one, but this is also a narrow therapeutic index drug. So patients, once they're stabilized on a specific brand or a specific manufacturer of a generic, they need to stick with that manufacturer. So Synthroid, synthetic thyroid, is the other. And you see that these are all dosed in micrograms. And they can be split, so it can be very specific to the patient. Now, some hormones contain both T3 and T4. Liotrex is one of them, and the brand name is Thyrolar. And then we have thyroid desiccated. So this is a natural product, and it contains both T3 and T4 because it comes from ground up and dried out pig thyroid glands. So the term desiccated actually means dried. So thyroid desiccated is Armour thyroid or Westroid. And it used to be that we measured this in grains, which is an apothecary measure, but we've switched over to milligrams, which is the metric for safety. Just a note, because this is a natural product, it stinks when you open those bottles. Now for hyperthyroidism, if somebody has an overactive thyroid, this occurs when the thyroid gland secretes too much T3 and T4 hormones. It can be caused by a tumor, a nodule, benign. It could be caused by thyroid enlargement, a goiter, or by an autoimmune disorder in which the body produces antibodies that stimulate thyroid-stimulating hormone receptors on the thyroid gland. Drugs used to treat hyperthyroidism will block the use of iodine by the thyroid gland, which will inhibit the production of thyroid hormones. There's a few different drugs. Methimazole, which is pictured here as Tapazole. PTU, propylthiouracil. Both of these kind of shut down the thyroid gland, and then we can actually completely shut it off using radioactive iodine. The last section we're going to talk about, maybe this isn't the last section. Next, we're going to talk about ovaries and testes. These are endocrine glands. We will talk more about these in the reproductive system. The ovaries are located above the uterus in a female, and the testes are located in the scrotum in a male. And the signs of puberty or adolescence in a female include breast development, axillary and pubic hair, and menstruation. And signs of puberty in male include enlargement of the testes and the scrotum, enlargement of the penis, axillary and pubic hair, and enlargement of the larynx with a deepening voice. The relationship to this chapter versus reproductive health is the delaying of puberty. So drugs for delayed puberty in females include using estrogen. And here we have esterified estrogen, which is known by the brand name Menest. Now your estrogens are going to be identified with the drug stem of estra. So by increasing estrogen levels, it can help move the body into puberty. And drugs for delayed puberty in males are related to testosterone, which is the male hormone, or an androgen. Now, all androgens are C3 drugs. They're controlled substances. So this is methyl testosterone. The adrenal glands are endocrine glands that are located on top of each kidney. Each adrenal gland consists of two parts, the outer cortex and the inner medulla. The adrenal cortex secretes three hormones: aldosterone, which helps sodium be reabsorbed from the renal tubules and back into the blood; Aldosterone receptor inhibitor drugs keep sodium in the renal tubules so that it is excreted along with water in the urine. These are type of diuretic drugs. Cortisol stimulates the liver to release stored glycogen in the form of glucose, and cortisol also exerts a strong anti-inflammatory effect. We'll talk more about that later in this chapter. Androgens are male sex hormones that are going to be discussed in Chapter 11, reproductive drugs. The adrenal medulla secretes the hormones epinephrine and norepinephrine, which are also known as catecholamines. Drugs based on these hormones were discussed in Chapter 13, as well as will be discussed in Appendix C. Addison's disease. The treatment of adrenal dysfunction is dependent on whether it's too much or too little hormone. When there is a deficiency of adrenal hormones, the condition is known as Addison's disease. Corticosteroids are used to replace the lack of cortisol. Prednisone is a prototype drug. The brand name is Deltazone. So this is a replacement of the steroids that are missing. If there is an overproduction of adrenal hormones, the condition is known as Cushing's disease. The drugs used will decrease cortisol secretion. So here we have osilodrostat, which is known as Asterica. Sometimes it takes me a minute, even though I know these drug names. Now, corticosteroids are used primarily for their very potent anti-inflammatory properties, which is why the other group of anti-inflammatory agents are known as NSAIDs, or non-steroidal. These drugs are most often administered topically or orally, and they can be also administered by injection. Excess use and high doses for a long period of time can result in Cushing's syndrome, which will reverse when the drug is stopped. Corticosteroids can also decrease the body's ability to fight infection. Part of the process that makes them good at reducing inflammation is they interfere with the production of white blood cells, which are important for fighting infection. Also, long-term use can cause a secondary diabetes mellitus. Prototype drug is methylprednisolone. It's known by brand names Medrol for the oral formulation and Solumedrol or Depomedrol for injectable. Lastly, we're going to talk about anabolic steroid drugs. Anabolic steroids build muscle mass. All anabolic steroids are control schedule 3. Anabolic steroids can be used to treat body wasting, osteoporosis, or anemia. I'm really getting tongue-tied tonight. Oxandrolone is known as Oxidrin. The use of anabolic steroids to increase muscle mass, strength, and endurance is illegal in amateur and professional sports competitions. The use of 2 or more anabolic steroid drugs at the same time is known as stacking. Often the dose is taken 10 to 100 times the dose that would be prescribed for medical use of the drug. The continued use of anabolic steroids can cause decreased sperm count, shrunken testicles, baldness, and irreversible breast enlargement in men, known as gynecomastia. In women, these drugs can cause baldness and excessive growth of facial hair. Other side effects include aggressive behavior, atherosclerosis, and liver cancer. The aggressive behavior is sometimes referred to as roid rage. Now it's time for more questions.